Hi, my name is Leah Holst, and I will be presenting on the topic of the potential role of community-based interventions in advancing eHealth literacy in older adults. While older adults are increasingly adopting the internet as a source of information, they are still more likely to lack the skills necessary to interact with eHealth to obtain accurate and relevant information. eHealth literacy is a measure of the ability to seek, find, understand, and appraise health information from electronic sources and apply the knowledge gained to addressing or solving a health problem. An eHealth literacy intervention is, simply, any process that seeks to improve a population's eHealth literacy. And a community-based intervention is one that is developed for local context by local people. The research questions I will be addressing are: what is the importance of eHealth literacy for older adults? In what ways can community-based interventions help improve eHealth literacy of older adults? And what are best practices for delivering eHealth literacy interventions for older adults in community settings? Several factors highlight the importance of eHealth literacy for older adults. For one, the changing healthcare system, which is increasingly centered around the consumer, means that adults are expected to take a more involved role in their health, and health literacy will be an important piece of that puzzle. Also, with more adults aging in place, and with 92% having at least one chronic disease, it will be important for older adults to be able to use eHealth tools to help prevent and manage their conditions. And finally, with the proliferation of health information on social media during the COVID-19 pandemic, it will be important for older adults to know how to locate high-quality health information. What the research shows is that there is a strong correlation between eHealth literacy and positive health behaviors, which suggests that improving eHealth literacy could improve health. Research also shows that while seniors are confident in finding health information, they lack the confidence to evaluate the quality of that health information. So moving on to how community-based interventions can help. As the number of people aging outpaces the number of caregivers, local communities will have to step up to help. Looking at the research, I found several factors that every study seemed to have in common. These include that the studies often utilize participatory design to develop technology-based services and programs that could become sustainable models for community interventions. Also, they are developed by people who live in the same community as the intended audience. Also, the advantages of being based in a local community is that these interventions can make use of already existing community organizations, and they can be modified to target specific populations or health conditions. I found several good examples of community-based interventions, but for the sake of time, I will only describe one. In Michigan, researchers studied African Americans with diabetes in Detroit and Flint, urban areas that are affected by low health literacy and health inequality. The goal was to develop an intervention using a combination of intergenerational information exchange and community-based participatory research. Participants helped design and develop a health intervention targeted toward diabetics. The study engaged both younger and older adults, hypothesizing that it would help participants learn how younger adults can support older family members and friends in learning to use technology. As a result of the study, Older adults showed increases in how positively they viewed learning about technology and increases in website use to find health information. Taking these examples into account, I identified some best practices for delivering eHealth literacy interventions in community settings. First of all, when figuring out your target population, it is important to identify underserved populations. One study concluded that in the region of China, where research was being conducted, libraries needed to focus on trying to reach older adults who live in urban settings and farm workers, for example. Also, when adapting the intervention for the local community, context is important. For example, in the Oklahoma study, public librarians were responsible for choosing the modules that would be presented as opposed to the academic librarians because the public librarians had more experience with the local patrons. And of course, when developing and evaluating the materials for the intervention, usability is important. This includes reading level. One study says that a 5th grade reading level should not be exceeded, while another says 8th grade, but the intervention designers should keep the needs of their own community in mind. Overall, the implications for this research are that it needs to be studied more widely in a greater variety of contexts because it is difficult to generalize results from local studies. But despite those limitations, I gained several important insights from this paper. For one, libraries are in a particularly good position to create interventions with their access to eHealth materials and their position in local communities. Also, participatory design studies and eHealth literacy go well together. And also, gaps in eHealth literacy that are exacerbated by local socioeconomic conditions can be addressed via community-based interventions. Overall, what I learned from this class is that we are all aging and should respect the aging process. I am more attuned to the possible challenges that older adult patrons face where I work. And the rise of aging in place has implications for information professionals and the vocabulary technology they must become familiar with.